My name is Miryam Bujanda, and I represent Methodist Healthcare Ministries. We are a nonprofit. We provide primary care for the uninsured in 76 counties, 1/3 of Texas. I'll be quick. Basically, I've got about 3 quick points. My written testimony is there. Our legislative agenda is there. And I hope you all will be calling me and saying, hey, what about this information or this number, and what does that look like for my district? So I'll make it quick. First of all, I'm sorry Chairman Colcourse isn't here because, Chairwoman Colcourse isn't here because, as you all know, part of the conversation this morning about the penalties really is not there for a lot of people, because when you look at the composition of Texas, 80% of the businesses in Texas are micro enterprises. I know you've already heard big, medium, small. I'm giving you a new term, micro, 5 or under. Okay, 80% of the businesses in Texas are micro enterprises. They are exempt. That's one thing. And then we've got numbers to show you what that looks like for your district. Having said that, when you then look at the HIE, once you do the HEBs, the essential health benefits that get negotiated, whenever it is, Representative Island, and let's say it's at the end of 2012, once you've got the HBs, then you've got to see who's going to play, right? Which insurance company is going to play with this? They're going to have the HBs there on the list and say, I'm coming into the HIE, Health Insurance Exchange. So it is critical that the state continue, as you mentioned, Representative Island, on top of it, not only with the HBs, but then with who's going to play at the HIE. Because if we do not have a robust HIE, then you won't have an affordable product out there. And no one will buy one, and it'll just, or the ones that are there are going to be cost prohibitive. So now you'll look at Texans and they'll say, well, I wanted to go out to the HIE and buy an insurance product, but because it's over 10% of my income, I too am exempt. And at that point, to them, as you've heard, it's not going to be the exemption that they were after. They were after getting insurance, affordable. So there is a drive. So don't go away and say, well, they're going to be exempt. Let me not worry. Don't go away because people want the insurance, but they want to be affordable. The more people you have insured, as you know, the lower the premiums should be. There are studies that show, and I've got that on my little paper there somewhere, when you've got insurance reform implemented, it will reduce the premiums anywhere from $1,600 to $2,400 for the same benefits a family has now. So we do want a robust HIE and insurance product. That's the last I'm going to say it, I promise. The prevention issues. Again, I was here for Dr. Sabian's conversation. Please don't throw the baby out with the bathwater. There are interventions in preventive measures that will save money. The studies show that from the mortality rates, 40% of the mortality rates are attributable to preventable causes. So I know we looked at the money, and then we looked at what preventable might be or not be, but if the mortality numbers are telling you that 40% of those deaths are from a preventable cause, we should be looking at those and saying what of those preventable things should we be doing. I'd be happy to work with the Joint Committee. Thank you.
Okay, we appreciate you being here.